state. It sounds like they'll be wet in Key West around midday today. So, well, like I said, I just want to welcome everyone to the Mid-Cap Month webinar, and we're privileged today to be joined by Dr. J. Bart Klika, or J. Bart, as I've taken to call him. I think that's your code name, Bart. So I want to provide Bart with a just due in terms of an introduction, but then we're just going to get right to talking about Florida's landscape, the nation's prevention landscape. And I think, you know, those of you who've been paying attention for the past few weeks, months, or even past couple of years now, Bart, we've seen just to me, a tremendous, I'll call it a cracking of the door to be able to not just do secondary and tertiary prevention, but to really try to look forward to what it is that we can do. And in Florida, we're talking about really working to identify and engage with families before they come to the attention of the Department of Children and Families. And, you know, Florida's been selected as one of the Tier 2 states for thriving families. So I know you obviously know a lot about that. And I'm going to look forward to learning more and to working with our state partners and figuring that all out. So let me go ahead and introduce Dr. Klika. Dr. Klika is the Chief Research Officer with our national organization. Of course, that's Prevent Child Abuse America. But though some of you may not know that Dr. Klika is also on the research faculty at Florida State University College of Social Work. And that's right here in Tallahassee, Florida. For those of you in Gainesville and Miami, that's the university that's in Tallahassee, the FSU Seminoles. So Dr. Klika is familiar with our state, to say the least. But prior to that, prior to coming to PCAA, he had a lot of experience too, and in doing things like being the assistant professor at the School of Social Work at the University of Montana. His research, things he's done over the years, have been to examine causes and consequences associated with child abuse and neglect. Of course, always in an effort with a look ahead to try and prevent its occurrence. But in 2011, Dr. Klika was selected for the inaugural cohort of the fellows for the Doris Duke Fellowship for the Promotion of Child Well-Being. That's a mouthful, Bart, but it's a national fellowship that provides support and mentorship for doctoral students seeking innovations in the prevention of child abuse and neglect. And Dr. Klika certainly fits that role. He's on the National Board of Directors for the American Professional Society on the Abuse of Children, or APSAC, as some of you may have heard it referred to as. And he's the chair, in fact, of the APSAC Prevention and Publications Committees. He's also the senior editor of the APSAC Handbook on Child Maltreatment. So it sounds like you're a little busy around the edges, Bart. And he's also associate editor of the Journal of Interpersonal Violence. We all know how connected those two are, where we're calling it interpersonal violence or domestic violence, or we know the association there. And he's currently the co-principal investigator, and this is one of the coolest parts to me, Bart. He's currently the co-principal investigator of a Centers for Disease Control and Prevention grant looking at the effects of paid family leave and child care supports in the prevention of multiple forms of abuse and neglect. Bart, we all know the connections are there. We appreciate you making time to be with us in Florida today. I know we were just chatting about what a busy time of year, how exciting it is though. And we're just really pleased to have you with us today. I will show you the screen for those of you who didn't know about Bart and I. I just put our pictures up there in case you're not able to look at your camera. And can you see my intro slide, Bart?
I can.
All right, good deal. Well, that was my picture before I got my haircut recently. For those who are looking at your cameras, you can see me there. I am Chris Lolley. I'm the executive director, like I said, and there's Dr. Klika's picture as well, and he's with Prevent Child Abuse America. And I'm gonna take off my screen now, Bart. People may have questions about that, but they can ask us in the questions box, because that's what we use on this platform. And I'm just going to go ahead, Bart, and make you the presenter so you can go ahead and show us everything you can tell us today about our landscape of prevention in Florida and the country.
Okay. Can you see my screen?
We can.
Great. So, I don't know how I followed that up, Chris. I can see the striking resemblance there, but
Yeah.
my picture, had I known we were doing pre-haircut pictures, I might have been a little bit more creative in my picture.
We'll get it next time for sure, Bart.
For sure, you can bet on that, Chris. But thank you everyone for being here today. As Chris said, I'm Bart Klika. What I like to say is I'm a father of 2 daughters. I'm a social worker by training, and I'm here representing the National Office of Prevent Child Abuse America, where I've served for about 4 years as the Chief Research Officer. And just a brief history about me as far as my connection to the field is I got my start in community-based foster and adoptive care work. And so working with kids coming out of group care and integrating into foster and adoptive families. And it was really that work that pushed me along to really think that there was more we could do to ensure that kids and families never experienced abuse or neglect in the first place. And so my career has taken me on quite the journey. For the longest time, thought that I was going to be a therapist, and the more I got introduced to research, the more I started understanding how it was that we could answer some of these pressing questions that the field has grappled with really since, I would say, the start, which many would claim would be the seminal writing of Dr. Henry Kemp in 1962 when he authored the Battered Child Syndrome. And even more recently, within the past couple of years, my work has really started focusing more on looking at the conditions in which children and families live. And so for those of you who are familiar with some of Bronfenbrenner's work about the social ecology, one of the components of Bronfenbrenner's idea is looking at what layer or what level of the social ecology do we intervene. And a lot of my work has been kind of zooming out a bit and thinking about policy as a context for intervention as it relates to the prevention of child abuse and neglect. So today I'm going to talk kind of briefly about where we're at as a field, talk about the current context of COVID-19, and then talk about some of the emerging trends in prevention. And a lot of these are national things that are going on currently. But I've left a lot of time, hopefully, for some questions. And please feel free to use the chat in trying to create a presentation. I inevitably have left out a lot of things. I was joking with Chris before everyone jumped on that even going through my slides this morning, I was like, shoot, I can't believe I forgot to put that in there. So please feel free, use the chat, put comments, and we should hopefully have plenty of time for discussion at the end. Really quick about our organization, Prevent Child Abuse America has been around since 1972, and we focus on the primary prevention of abuse and neglect. That means moving upstream to ensure that kids and families never experience abuse in the first place. And we do our work in different ways. First is through our evidence-based home visiting program, Healthy Families America. Florida has a strong system of Healthy Families America sites. We work with new and expecting families really to address the needs of the family, help with parent-child relationships, all in the service of promoting health, well-being, and preventing child abuse and neglect. Next, we do work at the policy level, at the federal level. I'll talk a little bit today about some of the historic funding that we're seeing with like CB cap funds, as well as McV, and even some of the funding coming down for childcare supports. And in the past few years, we've even started providing some TA supports to our state chapters on state policy issues. We also do some work around public engagement, public awareness, the framing of child abuse and neglect. How is it that we get the general public to understand our cause, but to do it in a way that doesn't shut people off? And so we've done some work with the Frameworks Institute on how do we frame the issue of child abuse and neglect. It is April, Child Abuse Prevention Month. You can see my lapel pin, Pinwheels for Prevention. This has been our symbol of child abuse prevention since about 2008, which has roots back to Florida, as a matter of fact. And then finally, our work is done through our state chapter network. We support a network of 50 state chapters. At any one point in time, we have a few chapters in transition. But really, that's who is doing the work on the ground to support the statewide coordination and implementation of prevention strategies. And so those are what we talk about, our core pillars. One of the things that our president and CEO always says about our work is that prevention happens in partnership. No one organization, no one model, no one sector is going to prevent child abuse and neglect on their own. And so we need strong partnerships to do this work. And where I sit, I spend a lot of time thinking about research and evaluation. That is both how do we translate what we know about child abuse and neglect prevention, and then actually conducting the studies that help build our evidence. So let's go ahead and jump in a little bit. When we look at the past, I don't know, 30 years or so, this is some of David Finkelhor's work. He's looked at some of the trends, and this is using some of our federal data in child abuse and neglect. And one of the high-level points of this is that over time, we've seen declines in child physical abuse and child sexual abuse, but we haven't necessarily seen the same trajectory with child neglect. And there's a lot of speculation about why is it that neglect has not decreased at the same rate that physical abuse and sexual abuse have. And some have speculated that it has to do that the fact that neglect and poverty are so intertwined. And as a field, we haven't done a decent job of disentangling the two. There's been work from the folks at the Centers for Disease Control and Prevention to estimate what they talk about as the economic burden of child maltreatment. And so they've done some work to say that each victim of child abuse and neglect over their lifetime will incur expenses of nearly $830,000 to treat the consequences of abuse and neglect. Now, it's important to hear that this is not the annual cost per victim. These are not receipts that have been submitted for different services. These are estimates about what it would cost to pay for services across a child's life for things like child welfare, juvenile justice, special education, as well as many of the productivity losses that could be experienced later into adulthood. And so one of the things that we wanted to do as a national organization to really support some of our chapters in understanding the implications of these estimates at the state level last year, and we're in the process actually of revising this manuscript, but we did a paper where we looked at the CDC's estimates of the economic burden of child maltreatment. We used the federal NCANS data to estimate what the economic burden of child maltreatment was for each individual state. And as you can see on this somewhat busy slide there, I hope everyone can see it, we provided different estimates on what it would be if we looked at investigated cases, substantiated cases, child deaths. And so I wanted to help facilitate the interpretation of this finding, or how you might make sense of it for some of Florida's data. So at the bottom of the screen, I have the interpretation. And so what we would say is, of the children who were investigated for child abuse and neglect in the state of Florida in the year 2018, combined, with the children who died as a result of abuse or neglect in that same year, those children will incur costs of nearly $244 billion over their lifetime. So just that cohort of children from 2018 over their lifetime will incur those costs. One note really quick, I'm happy to make my slides available to folks as well. I tried to hyperlink whenever I can. That's a hyperlink to the actual article. So if you have my slides, you should be able to access this article. Now, I think...
I'm sorry, Bart, I was just going to say, I'm going to post this to our website too. So everybody will be able to have it, and then I can send it out. Yeah, thank you.
Yeah, you bet. And I figured with this audience, I probably didn't need to explain the adverse childhood experiences study. But what I did want to bring to the attention for our discussion about prevention was a piece that was really led by our president and CEO, Dr. Melissa Merrick, before she joined our organization a couple of years ago. As many know, she came from the Centers for Disease Control and Prevention, where she really led the adverse childhood experiences work for the past 10 years. And what she did in this piece is they wanted to try to understand what percentage of negative outcomes could we prevent if we were to prevent adverse childhood experiences. And so what they found was that if we were able to prevent ACEs, we would be able to prevent upwards of 44% of depressive disorder, 13% of coronary heart disease, as well as things like smoking, drinking, as well as socioeconomic challenges in the household, including things like unemployment. So what this means in real numbers is that if we were to prevent ACEs, that means we could prevent nearly 21 million cases of depression. So it's findings like these that we've been able to use to say, look, if we really want to get ahead of the curve, look at what we're able to avoid in downstream costs if we invest in upstream prevention efforts. This is another figure that I like to share whenever we talk about the adverse childhood experiences study. This comes from Dr. Wendy Ellis, and she talks about the graphic of the tree to really talk about where our sites of ACEs intervention and prevention really should be focused. And what she says is when we think about the typical 10 adverse childhood experiences, those are like the leaves of this tree, right? They're the things that we see, they're the symptoms that we see. People come to our clinics, people we see when we go into their homes. But what she says is that adverse childhood experiences occur in the context of adverse community environments. And that if we want to prevent ACEs, we need to get below the surface and address many of what she calls the root causes of trauma and adversity. And that includes things like poverty, discrimination, lack of opportunity. When we think about ACEs prevention, we need to think about getting at the root causes, which is a theme that you'll hear me referring to throughout the presentation today. So that's what we've been talking about. These are recent things, and 2020 hit. In 2020, we saw a number of things. We saw a global pandemic. We saw racial and civil unrest. We saw natural disasters across the country. We saw early on in the pandemic calls for physical distancing or social distancing, which I think very quickly we had to start saying, you know, we need to keep physical distance but maintain social connection. Social isolation was a big thing for a lot of families. Hunger, housing instability, unemployment. These were all things that were pressures exacerbated for families over the year, as well as many of the pressures. I know as a father working from home, I felt very fortunate to maintain employment, but was balancing the many demands as a parent of providing online virtual schooling for my children, as well as the increased workload that we had over the year. So there's been many new and additional challenges placed on families and communities over this past year. Now, I didn't put this up there necessarily for you to read all the words, but wanted to show you that very early on in the pandemic, Dr. Shauna Lee from the Parenting in Context Research Lab at the University of Michigan did some survey work of caregivers to understand how they were doing. Now, keep in mind, she did these surveys within 2 weeks of the official shelter-in-place orders that came down. So these surveys were conducted at the end of March of last year. And even 2 weeks into the pandemic, caregivers were already reporting concerns about finances, being able to pay bills. They were reporting symptoms of depression, anxiety, as well as behaviors that would be concerning. So things like yelling or spanking their children. And so we know even early on in the pandemic, caregivers were starting to struggle and really saw that the time ahead was going to be one of significant challenge. You may have also heard of some work by Dr. Phil Fisher out of the University of Oregon through the Rapid EC project. In the early stages of the pandemic, they were conducting weekly surveys of caregivers to understand how they were doing. Now, I've only highlighted one of the findings from their body of work, and I use this one to highlight the fact that we also have to reckon with the fact that the effects of the pandemic were not equally felt across all groups. Low-income families, families of color, women were particularly hard hit when we think about things like employment outcomes, as well as some of the things that they saw in the EC project around mental health difficulties. So just a brief recap of where we're at. Child maltreatment, ACEs, can have lasting consequences. If we prevent ACEs, we can prevent mental health and physical health problems. We got to get to many of these root causes of ACEs. And we have to keep in mind that COVID-19, racial and civil unrest, and the natural disasters that we've seen over the past year have created new experiences of trauma, or what some have even called adverse COVID experiences for children, families, and communities. So when I was talking about root causes and the work of Dr. Wendy Ellis, one of the things that we use as a guiding framework in our work at Prevent Child Abuse America is a public health approach. Now, we use the Institute of Medicine's definition of a public health approach, which is what we as a society do collectively to assure the conditions in which all people can be healthy. And I point out two things from that definition. The first one is the idea of collectivity. We've seen, and you see my graphic there, around the idea of mask wearing. In the past year, we've seen more discussion and understanding of what public health and action really means. And if you take the example of mask wearing, we know that mask wearing is only as good if everyone is doing it. So when we think about public health approaches, we think about that term of collectivity, what we do as a society collectively. The second piece of that is the idea of conditions. How is it that we get at many of those root causes of adversity that we saw in that tree graphic? So let me use the quick cliff analogy to talk about some of our work in child maltreatment prevention. So imagine, I'm now in the Midwest. I used to live in Montana. When you live in a place like Montana, you can use an analogy like a cliff. When you live in the Midwest, it doesn't leave much aside from saying, okay, imagine you're on a beautiful overpass somewhere. But in Florida, I know that you've got some rolling hills. So imagine that you're at the top of a beautiful cliff. And from that cliff, you have amazing views. You can see the sunset. You can see all the landscape around it. But we start having a problem. The problem is that so many people are going up there. They're taking pictures of the beautiful sunsets, and what happens? People start getting injured because they start falling off the cliff. And so as a community, we can come together and think about strategies of what we could do. The first strategy is what we think of as tertiary prevention. Tertiary prevention means that we could put ambulances at the bottom of the cliff. When people fall off the cliff, we can get them patched up and sent on their way. In our work in child abuse prevention, this is typically what we think about as treatment for kids and families who have already experienced abuse and neglect. The idea is to stop the abuse from happening and to minimize the consequences associated with its occurrence. Now, some could say, well, it's not so much falling off the cliff that hurts people, it's really the smacking into the ground that hurts them. So what if we were to put up safety nets halfway up the cliff to catch people partway down to sort of, in essence, break their fall? And this is what we think of as secondary prevention. And secondary prevention is really working to try to identify individuals, communities who might have particular risk factors for abuse and neglect, but otherwise are not currently experiencing abuse and neglect. That's what we think of as secondary prevention. And then finally, we could say, well, if we really wanted to prevent people from falling off the cliff, we could just use a primary prevention strategy and put a fence at the top of the cliff. This is what we think of as primary prevention, and that is thinking about strategies oftentimes that are employed universally, meaning across the population, to ensure that no family or child ever experiences abuse and neglect. But a couple points of clarification with this slide. The first one is I want to make sure that what people are not hearing me say is that primary prevention is better than secondary prevention and secondary prevention is better than tertiary prevention. If we're actually going to create a true prevention system in our communities, in our states, and as a nation, we need a coordinated system of prevention that includes primary prevention, secondary prevention, and tertiary prevention. So what we like to say is that we need a system of prevention across that prevention continuum. At the same time, we need prevention across sectors. This is not just a problem of child welfare. This child maltreatment is an issue that cuts across sectors. It includes early intervention, maternal and child health, education, social services. It includes all of these different sectors needing to think about ways to build bridges, to work together, to pool resources, to be able to support kids and families and communities. And then finally, when we talk about prevention, we also say that it should be across the developmental continuum. So we do a lot of work in the early intervention space, working with kids 0 to 5, or actually I should say prenatal to 5. But I think it's important to note that kids and families don't stop having needs when a child turns 3 or a child turns 5. We have to think about how we do a better job of coordinating our programs across the developmental continuum and making sure that families have the necessary supports that they need at different developmental stages. So examples of primary prevention, programs of home visiting that are delivered universally to populations, not necessarily based on some measure of risk. Family resource centers, campaigns that raise awareness about child abuse and neglect. Secondary prevention examples include things like targeted home visiting. So when we're looking at eligibility for families to receive services based on some criteria of risk. And then tertiary prevention really being working with families who have already experienced abuse and neglect. So think of child welfare or other types of treatment programs. It's also important to highlight, though, that not all communities are created the same. We know that there are differences across our communities in access to care. We know that there are differences as well in the quality of care that kids and families can receive in communities. And we also know that there are significant differences not only in exposure to risk, but also in exposure to opportunities. So as we think about our prevention programming, not only are we thinking about this issue of across the prevention continuum, across sectors and across development, we also need to understand that we need to make very intentional efforts to address systemic inequities that affect so many kids, families, and communities across this country. So brief recap of this section. When we think about public health, we're addressing the conditions collectively We need a coordinated system across the prevention continuum, across development, and across sectors. And we have to recognize that vast differences exist across communities, and we need to take intentional efforts to address these inequities. So the CDC has come up with recommendations. Many folks have probably seen the CDC's technical package for child abuse and neglect prevention. They also have one for ACEs prevention, where they've reviewed the science and evidence to suggest a set of strategies that show the most promise in preventing adverse childhood experiences. And they include things like addressing economic supports, making sure that we're addressing the societal norms that either promote health or perpetuate violence, ensuring a strong start. This gets at a lot of our home visiting work that we do through Healthy Families America and many of the other early intervention programs that we support. And then on the bottom, you see things like some of our direct work with kids and families. How is it that we do the teaching of skills? How do we think about things like mentorship? And how do we strengthen our response for the kids and families who have experienced abuse and neglect? So this is one of the slides I actually added this morning because I think we're at a historic moment where we've seen through the American Rescue Plan increases in programs like the Maternal, Infant, and Early Childhood Home Visiting Program, through our CB-CAP funding, our community-based child abuse prevention grants that really support a lot of the community-based prevention work that many of our chapters are engaged in, as well as some of the supports that have come through for things like childcare and helping families reduce the burden of what we know is a real issue for many families in accessing high quality childcare. And so we have a unique opportunity right now to think about supporting some of these initiatives that I'll be talking about. So one thing Chris had mentioned at the beginning that we're working on at a national level when we think about transformation of the way that we do things. Some have talked about we're at a moment where we can envision what could be conceived as a quote unquote better normal. As part of that, we have partnered at Prevent Child Abuse America with the Children's Bureau, the Annie E. Casey Foundation, and Casey Family Programs to support the Thriving Families, Safer Children initiative. And I say the term initiative, and what I really mean is it's a movement across the public, private, and philanthropic sectors to really think about the creation of a child and family well-being system. We're not talking about tinkering around the edges with child welfare. We're really talking about creating that system outside of child welfare that allows kids, families, and communities to access the voluntary supportive services that they need that help them avoid child welfare involvement altogether. Part of this initiative, big piece of the foundation of the work is around equity. And how is it that we create not just equitable access to inequitable systems, but how do we create systems that are equitable and create equitable outcomes for all kids and families? And another central piece of this work really has to do with engaging lived expertise. How is it that we share power with families in a way that many of us haven't done before, and in the creation of our systems we haven't done before? How do we take the voices of families, the voices of communities, and embed that into the design of our system? We currently have 2 rounds of sites. The first round of sites, we have 4 sites across the country. These are really serving as what we think of as our demonstration sites. And then recently we have brought on another approximately 18 jurisdictions that are really working on policy and system issue reform, and Florida falls into that category. Here's a map of some of the sites that are included. I will just note Rhode Island is included on here. They are not part of the Thriving Families Round 2 work, but this just gives you a sense of one initiative that's really looking nationally at how is it that we really rethink our approach to working with kids and families. Now, Florida has such a strong contingent of Healthy Families America sites. But really, I think when we think about nationally and some of the work being done in child abuse prevention, home visiting has really been a gold standard in child abuse prevention. And this dates back to the U.S. Advisory Board on Child Abuse and Neglect in the late 80s and early 90s. And one of their key recommendations that really never came to fruition was around universal home visiting, making home visiting universally accessible to all new and expecting families. We've seen the work of Dr. Deb Darrow from Chapin Hall in the past couple of years really making a call for how do we create this universal system of care and support outside of child welfare to ensure that all families get the support that they need. At Prevent Child Abuse America, one of the things we've been talking about for the last couple of years is the notion that all families need support. The type, the timing, and quantity of that support might differ, but it's our belief that all families need support. And by creating universal systems of access to services like home visiting, we're able to get families the timely support and care that they need. The other area is family resource centers. What we've heard time and time again, whether it be from home visiting, mental health, or substance abuse treatment, is the stigma associated not only with help seeking, but also in the actual receipt of these services. And family resource centers have really expanded across the country, largely through the National Family Support Network, a lot of their work. But really, family resource centers become that non-stigmatizing place where families can get connected to the resources that they need, that they can come together and support one another in a non-stigmatizing way. And there's evidence starting to emerge that in places that support family resource centers, we're seeing decreased reports and investigations for things like child abuse and neglect. We've also seen the emergence of primary care interventions like the SEEK model, Dr. Howard Debowitz's work, or Project Dulce, some of Dr. Bob Segi's work. And in essence, these are interventions that are embedded within primary pediatric clinics that don't necessarily just focus on the medical needs of children, but really look at children in the context of families, in the context of communities, and really work to make sure that families have their needs met, because we know that families that don't have housing, they don't have food, we need to first and foremost ensure that they have their basic necessities met. And then we can start working on some of these other things like parent-child relationships. So some of these primary care interventions are based out of pediatric clinics, but really take a more holistic view on addressing child and family needs. And then the area, of policy. There's been a lot of research coming out over the past couple of years on the effects of policy on reducing child abuse and neglect. So we've seen studies on the refundable version of the Earned Income Tax Credit and its association with reduced hospital admissions for abusive head trauma. Paid family leave. Studies out of California looked at the implementation of paid family leave and saw statewide reductions in hospital admissions associated with abusive head trauma as a result of implementation. And things like minimum wage. For every dollar increase we see in minimum wage, we see a reduction in things like child neglect. So policy has been a really strong strategy for thinking about ways that we can prevent abuse and neglect. So here, I'm just going to bring this resource to your attention. I'm going to actually skip over a few of the Florida-specific slides that I had embedded here, but all this is to say is the Prenatal to 3 State Policy Roadmap. This is out of Texas, Dr. Cynthia Osborne's work. They've done a fantastic job of reviewing evidence on what supports child and family well-being. What are some of those policies that show the most promise? What are some of the strategies that show the most promise? And then they've gone to the level of actually creating state-level report cards to help states understand, how are you doing across these policy areas? How are you doing across these strategy areas? And the few that I just highlight really quick are paid family leave. This is something that many states are starting to adopt across the country. State minimum wage, looking at whether or not the state has at least a $10 minimum wage, but also whether or not it's above the federal minimum wage, as well as state earned income tax credits, and looking at whether or not states have a refundable option, and then looking at the percentage of eligible adults that actually qualify but otherwise are not taking advantage of that tax credit. Childcare subsidies is another area. So just really quick in closing, want to put a plug in. Many of these ideas are going to be covered in our national conference that we'll be hosting August 10th to the 12th. It's a virtual conference. Early bird registration is open. Currently, we're accepting proposals from folks. And so I would encourage everyone to take a look, sign up, attend the conference, consider presenting some of your work. And at this point, I want to stop sharing my screen, and so we can have some conversation, answer some questions, and find out what's really resonating for folks from what I shared today.
Well, thank you, Bart. I knew that you were going to do an excellent job as always, but there's so much to comment on. We've had a few questions, and I'll touch on one of them in a minute, but I have to say, although we have a long way to go, I was first exposed to formal prevention work back in 2007. That seems like a really long time ago now. But one of the things that really got me when I was first being exposed was just the economic benefit of investing in prevention versus, having so many children come into care, the cost of providing services, but really it goes way beyond that to just being in good health in general for children and their parents, of course. And then I'll also say that I'm really glad that you touched on what you call the prevention continuum, because I think that's one of the things that we're really starting to get a handle on now in Florida, with some of the work that we're doing after Families First, and of course getting ready or having awaiting the approval of the plan that was presented. But I really wanted to just ask you if you could comment on, where's that line? What is it that we need to know about? Like, do we do just secondary? Do we do just tertiary? Do we do just primary? I think we all know the answer to that is no. But where are we now? We're just getting started, right? And realizing that if we're doing tertiary prevention, we really are doing primary prevention. If we're doing secondary, we really are doing primary. So I know you have some thoughts about those things.
Yeah, well, you already gave my answer, which is, you already gave the answer, Chris. But really, I think one of the conversations that we often have, because we promote primary and secondary prevention, and we say, we really need to tip the balance. One of our prior estimates that we would oftentimes use is we would look at child welfare spending across the country. So Child Trends put out a report, and it was somewhere in the ballpark. When you look at fiscal year 16, it was somewhere in the ballpark of $16 billion that we spend on in fiscal year 16 on federal, state, and local expenditures for child welfare. And then if we look at our dedicated source of federal prevention funding, which really was CVCAP, at the time that we were looking at this, it was around $54 million. And so when we look at the balance that we currently have, we're obviously tipped in the direction of financially supporting tertiary prevention. And I think we talk about the need to tip the scales. Now, one of the challenges that this often places us in, though, however, is that it puts us in competition with our colleagues and friends in child welfare, in treatment services, where we find ourselves at hearings, we find ourselves in the same room arguing with each other about, well, no, I think you should fund my program. Well, no, I think you should fund my program. And that's been such a struggle, I think, for us as a field, is that we find ourselves oftentimes fighting over the small slice that we have. And I think, findings like we have from what I showed, that vital signs from Dr. Merrick's work about, being able to look at real tangible things. So looking at depression, looking at, many of the leading causes of death in the US and seeing their association with early adversity. I think it's those types of things that are starting to catch the ear of policymakers. They're starting to understand this. And for those of you who have been doing this work for longer than I've been alive, you're like, well, gosh, it's about time. We've been saying this forever. But really, the idea is we need to continue to share those messages of prevention and to show the real tangible benefits of what we can save later on down the road if we are to prevent things. But I'll also go back and say, a robust prevention system does not only invest in primary prevention, it invests in coordinated primary, secondary, and tertiary prevention. That means our primary prevention folks are talking to our child welfare folks, and that they understand what each other are doing, and then creating it across sectors and across the developmental continuum.
You said so much just in those few moments, Bart, but I did want to go back to touch on one of the questions that we got about the school system, because I know when you talk about how the systems integration has to happen, and really I'll use your points about family resource centers as an example of this, because I think the more we realize who it is that we need to listen to, meaning people with lived experience, the parent voice, so to speak, the youth voice. I saw a really powerful presentation yesterday from a young lady who grew up in care and is working with our One Voice Impact initiative here with the Florida Coalition of Children. Everybody, Bart, gets it. We all know that we have to have the continuum and that we have to braid the funding and have a coordinated effort. But when you hear her tell her story, and she's certainly, not the only youth who grew up in care who could open our eyes some, but to realize what it was really that she needed at the time that she needed it, for us not to listen and not to pretend like we need to have those people at the table to be able to give us input and really help us guide the reforming of the system, so to speak, or the transformation of the system. I just be curious, the lady who asked this question says, we don't teach parenting in schools, and why not? So I'll go back to something I used to say, and I'm not sure if this was just a subtle dig at me when you said people who've been doing this work longer than you've been alive, or maybe you're talking to some of the other people who were on with us too. But
that's for you, Chris.
But we've known it for a long time. We said as child protective investigators back in the late 80s, early 90s, it's a shame we don't do more to stop this from happening before it starts. And we knew just, inherently what we were seeing and what we could do. But I said after I became a trainer, you have to have a license to fish, you have to have a license to hunt. But if you've got biological equipment or not, you can be a parent. And it's apparent that that's not always a person who's prepared for doing that. So I think we're seeing some movement around blending the system, so to speak, our education department, our social services departments, and getting into the schools would be a way to begin to address some of those issues and to talk to children, whether they've been abused or whether they haven't been abused, just about being prepared for the immense job that being a parent is.
When we've done some work over the past year, I've been working with some colleagues at Maryland and Penn who work more on the education side of things. And my concern as I heard people talking about the pandemic was, everything was kind of being piled back on teachers and educators. They were saying, oh gosh, rates of reports are down, and this is because mandatory reporters aren't having the physical contact. They're not seeing kids on the playground. They're not there to notice interactions with kids or overhear comments on the playground, or to see Johnny, going and sitting in the bathroom in between classes. And there was a lot of talk about when kids are back in person, we're going to see these big surges, and teachers better be ready. And so I got really interested in thinking about, how do we start seeing educators and the education system as partners in this work, but not putting the onus of the response on the educators and teachers. What I like to say is that we need to ensure that kids come to school ready to learn, so educators can do what they're trained to do, which is to teach kids, and that we build the system of support around the educators. That can be embedding family resource centers in schools. And so educators and teachers have somewhere to go if they have a concern about a child. Now, what I'm not saying is that educators shouldn't care or shouldn't be worried about kids or shouldn't have training in trauma-informed classrooms and trauma-informed care, but that we have a place for educators to refer kids and families onto when there is a concern. And hopefully that referral is someplace that is outside of the child welfare system, because we know so many of the cases that come to the attention of Child Protective Services are as a result of child neglect. And we know that many of those challenges could be addressed with concrete resources provided early on. That could be housing, it could be food. And so we have to build that system of support. And what I've heard from the National Family Support Network, Andrew Rousseau says, embedding family resource centers in school makes a lot of sense, because not everybody in the community would know where a family resource center is, but everyone knows where a school is at. That's right. And so when we think about schools or education systems as a site of potential public health intervention, not putting the onus on educators themselves to do it all.
Yeah, well, and along those lines, Bart, I see a friend of ours, Dr. Shelby, has weighed in too, and she says, to your point, Chris, about everyone needing broad education about parenting, I think teaching people how to support parents is important too. She knows, we all know, there are people that are willing to help, but they may not know how to go about that, how to reach out to them. So she wants to hear us talk a little about that. I'll start out by saying this is something that I've been taking more time to focus on this month, Bart, during Child Abuse Prevention Month, is to give people concrete ideas about what they can do. And really, there's a lot to be said there. I want to hear what you have to say. I'll just offer a couple of points that I've been talking about, but really just noticing when parents are struggling, or when families are struggling, or they could use a little help, just being aware and noticing those things. And even if you just offer an opening for someone to talk to you about it, or if you do something for them, like if you're a good cook, make them a meal. If you can be a big brother, a big sister, by all means do that. If you feel led to do more, do more. But I'll just hand it over to you by saying that I think there's a lot we can do, but catching the children and the families early on before they get to that crisis is really where we need to be positioning ourselves. So maybe they haven't made it to school yet, but can you talk just a little about engaging the community in preventing abuse and neglect?
Yeah, it's a great question. It's great to see my good friend and colleague, Dr. Shelby, on. Just really quick before I answer your question, her and I have been doing some work over the past couple of years, really thinking about how we do a better job engaging policymakers, researchers, and practitioners in this work of child abuse prevention. And so making sure that researchers are asking and answering questions that are relevant to the field, that they've got input from people who are actually doing the work, and that they're engaged with policymakers, so policy isn't being created outside of the context of evidence or outside of the context of those who will be implementing the policy. And more recently, we've been having conversations about where does this idea of lived expertise fit into that? How do we start engaging families and communities in some of this work? I think to your point, Chris, I mean, you provided some good suggestions there. I think we also, some of it is, changing our lens as well, that our work with Thriving Families has challenged, I think, all of our national partners, but has challenged me personally because it's made me slow down and really listen. And I think that that's one of the things we have to do better with our communities, is that we have to come in and we are outsiders coming into communities, and we have to listen. And we have to listen with different ears. And we so often, because we're concerned about kids and families, what we're looking for, what we're hearing are all the risks, are all the concerns. And that makes us skip over all the sources of protection, all of the community cohesion that's going on. We oftentimes talk about community supports, and we forget the idea of informal supports. We do service array evaluations to look at what services are in the community, and we say, look, this is a resource-rich community. But my question is, are those the resources that the community wants? Are they the resources that are allowing families to receive the services that are going to help them achieve health and well-being in a culturally relevant way? And so I think, to me, it's both, lending support where we can, being a good neighbor, but also for us who are professionals, thinking about how we enter into community. How do we listen in a different way? How do we put on different glasses, different ears, to be able to hear these sources of strength and protection that all these communities have?
Yeah, we've talked about strengths and needs for forever now, for a long time. But the way you put it, and I've heard, we've heard other people talk about perspective before. I've heard it said we have 2 ears and 1 mouth because we're supposed to listen twice as much as we talk. I think the finger really points back at me when I say that kind of thing. But I have to put in a plug too for one of our colleagues. Claire talks about, you mentioned, about the reporters, mandatory reporters. So, Claire says, let's also become mandatory supporters, not just mandatory reporters. And I see Maria has chimed in saying that Hendrick County School, which is a very rural county, by the way, Bart, down south of Orlando a little way. She said they started an outreach center. I think you could equate that with the type of resource center embedment that you were talking about before. But I just like the line of in addition to meeting our responsibility, and in Florida, everyone is a mandated reporter. There's no question about that. We've had too many tragedies for us to forget that, But when heading this off at the pass and getting to the top of the hill and building the barrier to keep people from falling to start with, that's an excellent thing to do. And Maria, thank you for telling us about that. Let's all be mandatory supporters as much as we are concerned about the back end.
You made a really important point, Chris, because this idea of mandatory supporters, I think, is embedded within a larger cultural shift that we're talking about in our child and family serving systems. And that means that we are creating that child and family well-being system outside of child welfare.
Right.
And so when we're training our mandatory reporters about their legal and ethical obligations to report suspected concerns about child abuse and neglect, that we're also doing training to say, look, we've created this child and family well-being system. Can we start to understand something between, for example, the issue of child neglect? What does a family need versus what is a case of neglect that would need to be reported to the system? So we just want to make it clear that we still recommend that when people are concerned about cases of child abuse and neglect, that by all means you fulfill your legal and ethical obligation to report. But we're talking also about a cultural shift where we have a system of support that we can refer families to early on.
Yeah. Well, and I think as much as anyone, supports that concept, Bart. The people in the system, so to speak, support that approach. You know, what can we do to continue to support families, to get them the help they need? You talked about destigmatizing the ask. And I say we have to destigmatize the accept, you know, because it's tough. You know, people are proud and they're really wanting to stand on their own 2 feet, so to speak. So as we build this system, I think we'll build trust and we'll have people be more willing to accept help because it'll be seen as coming from someone who really does want to help. And it'll be more likely to be received. And as we build trust, we'll build that system that you're talking about, Bart.
Yeah.
Yeah. Well, thank you, Bart, so much. I knew it was going to be an excellent webinar presentation when you agreed to join us. We appreciate you spending some time with us down here in the Sunshine State today. We know we got a long way to go, but I'm really excited about the work that's already being done. I think our legislature certainly understands where we need to go. And there are a lot of leaders in a lot of the places that we've identified today who know and who are really pushing us to push that envelope and get children and families the support that they need so we don't have to see them in our system. So thank you, Bart. We appreciate you spending time with us today.
Well, thank you for having me. Thanks to everyone on today. My contact information is on my slides. I'll make them available to Chris so everyone can have them. And, you know, my only regret about today is the fact that I wasn't able to be in Tallahassee with you, and look forward in the coming future to come down to Florida and be in person with you all.
It's going to happen, man. We're getting there. We got hope. We got optimism. We got hope for our kids and hope for us at this point. So we'll look forward to welcoming you back to our state in the not too distant future, Bart. Thank you, and stay warm up there.
Will do. Thanks, everyone. Bye-bye.
Sure. Thank you, everybody. We'll make this webinar part of our Prevent Child Abuse FL webinar and podcast page, and you're welcome to go there and check it out at your leisure. Send a link to other people. Give us a couple of days. We'll have it up, and thank you all very much for joining us. We appreciate you a lot. Have a good rest of your week.